Thank you, Mr Deputy Speaker. And the topic of today's matter of public importance is as short on words as it is on substance. It's as short as words as it is on fact. Now, Mr Deputy Speaker, the previous speaker spoke about the so-called state of healthcare in the regions. Now, I come from regional Australia. I come from the Sunshine Coast, and I think I'm fairly well placed to speak about healthcare from a user's perspective. Mr Deputy Speaker, yesterday, today and tomorrow, each and every single day, 8 Australians will take their own lives. Usually, on average, 5 men and 3 women will take their own lives. And for every one person that takes their own life, 24 will attempt it. This is an absolute scourge that is happening to our society. In fact, I'm sorry, I've misled the House inadvertently. It's not 24, it's 32. 32 will take their own lives for every one person that takes their life. We as members of this House must always remember that mental health should be above politics. And I want to commend and set out some of the things that this Minister for Health has done in relation to mental health. Now, in my own electorate, because that's what I understand the most, he's done some incredible things. He's provided funding for the Thompson Institute, the Neuroscience Research Centre, $7.5 million to provide research and clinical care of people who suffer from dementia, people who are youth mental health and suicide prevention programs. He's funded that, the Commonwealth Fund has funded that through this Health Minister for 3 years. He's provided funding of $12 million to build a residential facility for people whose families are living or having to be treated at the Sunshine Coast University Hospital. He's provided $6 million for the construction of Australia's first residential eating disorder facility. I see the member for Sydney raising her eyes there. Australia has not had one residential eating disorder facility. When you look at other countries around the world, that we know that the best form of treatment for people with eating disorders is a dedicated residential facility.
The member for Sydney on a point of order.
The member opposite to withdraw his reference to me. I was not listening to him or responding in any way to what he said. I was not even facing him, so I don't know how he would have seen my face.
I'll withdraw. I thought I saw you raise your eyes at the sky, so I'm happy to withdraw that. But, Mr Deputy Speaker, NDED Butterfly House are building Australia's first residential eating disorder facility. Eating disorders are a scourge of our community, and for the first time, the federal government is really stepping up to the plate and providing funding for that scourge. Now, the Sunshine Coast is becoming the epicentre for treatment of eating disorders. It commenced the pilot, a $3.2 million pilot for the treatment of eating disorders, and we saw that the federal government rolled out a program of treating eating disorders, listing it on the Medicare benefit scheme, giving it a benefit number. It's providing 20 psychotherapy sessions for complex eating disorders and for less complex eating disorders, and up to 50 psychotherapy sessions for people with anorexia nervosa or other complex eating disorders. Mr Deputy Speaker, this government has invested another 110, or will invest another $110 million to roll out these programs right across the country. So this is not just a matter of what's happening in my electorate, but right across the country.
I thank the